Namaste, myself Dr. SP Moosath. Today I would like to convey some views about therapy centers for these autism related cases. How a therapy center should be, or how we should select, what will be the criteria to select a therapy center. Because in my experience I have seen many patients are going to different therapy centers for speech one center, for behavior therapy one center, maybe for some sensory integration therapy another center, occupational therapy another center, and psychological analysis another center. So what I see is many a times these should go hand in hand. Some things are dealt according to the rule of behavior therapy. Maybe some things has to be dealt as an daily living practice. That training has to be given, that maybe a psychologist has to do, or sometimes we may have to get the help of a occupational therapist. So many times we may not be able to differentiate between what are the things has to be done for a kid in different therapies, or different professionals has to be done, but somebody should be there to answer for that. Because I have seen, when we ask something about some behavioral issues, sometimes that psychologist may say that you just put this word to those who are doing sensory integration therapy or occupational therapy. You just put a word to them, they will deal with that. And sometimes sensory integration therapy, what they are giving, or some kind of prompting that we are trying to do, a speech therapist can do better. So there will not be anybody to have a responsibility for doing or clubbing all these things to a single child. So I feel better a therapy center, or while selecting a therapy center, it may not be a full-fledged AC, that look wise it may be anything else, but professionalism should be there. There should be a single person, or a father should be there for deciding factor should be there, so that whatever the behavior therapists are doing, or speech therapists are doing, or sensory integration therapy is doing, there will be a coordination in that. So that you can ask somebody as a parent, you can ask the head of that institution, or the director of that institution, that what is the change in different therapy professionals are doing. So better go for a therapy center where it is having everything, like sensory integration therapy should be there, occupational therapy should be there, or physiotherapy should be there, behavior therapy should be there, psychology should be there, speech therapy should be there. So there will be a rapport between all these things. With, if we needed, you should have a medical advice also, you should get from there. So kindly take care of these things. If any inquiry, you can just call me. Namaste.